I'm Dr. Jelaine Bullock-Berquist, social media editor for Seminars in Arthritis and Rheumatism. This is part 2 of our author interview series featuring articles from the June 2022 issue, which is available online. Today I'm talking with Dr. Sinead Maguire. She is a Dublin, Ireland-based rheumatologist and lead author of the article, What to Expect When Women with Axial Spondyloarthritis Are Expecting: Prevalence of Complications of Pregnancies in Women with Axial Spondyloarthritis. Keep watching for the complete interview. Well, thank you for joining me, Dr. Maguire. I think this is such an important topic to talk about. I really enjoyed reading your article.
Thank you.
Do you think you could go through it for us with the purpose, methods, and results as you see it?
Yeah, absolutely. So I love talking about this topic. We've been working on this project for a long time. So as I think everyone is very aware, pregnancy is, it's a very common life event, but it's also a major life event for many of our female patients. But for women with AXPA, there's really very limited data in terms of pregnancy outcomes in this population. And so we have been studying women with AXPA. And so we wanted to take a closer look at this and to see, is this something we need to be worried about, or is everything on par with the general population? So what we did is I'm working with a large national registry called the Ankylosing Spondylitis Registry of Ireland, or the ASRI. And we actually developed a section within the registry that captures information on pregnancy, fertility, and breastfeeding. And we use this information to look at the prevalence of complications overall, but also at specific pregnancy and fetal complications. And then what we did is a couple of years ago, we actually published a systematic review on this topic in Seminars, and we used the control population from that systematic review, which was massive. It had data on over 1.2 million pregnancies from 10 different countries. And we used that as the comparison population, which generated a global reference norm. So it gives you an idea kind of how women in the general population in the rest of the world are doing. And what we found, that I think the most striking finding from this analysis that we really weren't expecting, is nearly half the women in our study, I think it was about 48%, reported at least one complication in a single pregnancy. So if you look at the number of pregnancies overall. And then when we looked at individual complications, there was certain complications that were significantly more prevalent in pregnancies of women with AXPA compared to the general population. And those were preeclampsia and preterm birth. And gestational diabetes, there was a trend towards it being more prevalent, but it didn't quite reach significance. We also looked at fetal complications, and only one reached significance in terms of being more prevalent in AXPA pregnancies, and that was low birth weight. So, obviously it's quite concerning that these are happening more frequently in women with AXPA, but it leads to a lot of additional questions. Just before I forget, we also looked at prevalence breastfeeding in this population, and we looked at that within each pregnancy. And it actually was quite low. It was only 33.7% of pregnancies, which resulted in live births, had any exposure to pregnancy. So, to breastfeeding. So that's whether you were the woman breastfed for 1 day or exclusively for a period of 18 months, which again is quite striking. And then we also looked at fertility, and we asked women, do you struggle to conceive? We define that as, trying to conceive with unprotected sex for at least a year. And that actually was on par with results reported within the general population and also within the Irish population as well. And then the last thing I want to mention is disease activity, because I think that's an area that lots of women are worried about before they become pregnant. And our previous systematic review found that disease activity tended to peak in the second trimester. And we actually found a similar kind of pattern within the women in our population, with a high percentage of them reporting that their disease was more active during the course of their pregnancy, and then a lower percentage reporting postpartum flares. So, and I think that's really important because there's this perception that with inflammatory arthritis, disease goes into remission during pregnancy, and that's based off of data from rheumatoid arthritis. But this tells us that, we know for lots of reasons, rheumatoid arthritis and AXPA are very different. And this further reinforces that fact. So that was our study in a nutshell. I think like any good research, it kind of brings up a lot more questions than we initially sought out to answer. But at the same time, it gathered, like doing this kind of research, we got a lot of interest from patients who are involved, and it's hopefully going to inspire lots of future studies.
Can I ask a couple follow-up questions to what you just said? One is, do you, I don't know, have any ideas or thoughts as to why breastfeeding might be less common in people with axial spondyloarthritis?
Yeah, it's a great question, and it's one that we talked about a lot. I mean, breastfeeding is one of those things where it's highly, highly influenced by trends in society, and also by personal preference as well. And, we've also, the advice that rheumatologists have been giving women has also changed quite dramatically in terms of medication exposure and ability to breastfeed. If you look at how recommendations have changed over the past 40 years and medications that are available in AXPA. So I think it's a multifactorial kind of issue, but I think it's also one that, similar to pregnancy overall, I think sometimes it's something that maybe isn't always discussed beforehand. And so maybe a woman might be under the misconception that she can't breastfeed if she's on medication, or there might be a lot of anxiety over being on specific medications and breastfeeding. And, of course, every woman wants to do what's best for her baby. And I think this data shows us that, we need to actually be encouraging our patients to be breastfeeding and having those conversations around what medications are breastfeeding compatible and what isn't, and what we can kind of do to kind of meet the mother's expectation before she actually delivers, so we can optimize her disease control in the postpartum period when we know she's going to be sleep deprived and tired and stressed and all those things, which puts her at a higher risk of flares. So it's complex, but I think it's something that if we think about it a little more, they're short conversations that I think would actually make a huge impact on our patients.
So important to continue to follow patients
Absolutely.
with inflammatory arthritis throughout their pregnancy, to make sure that we're having these conversations and that they know what to expect. Last question I had was about your own practice. I understand you're a practicing rheumatologist as well. Will this study, or will this research of yours, will this change your practice of rheumatology in any way?
Great question. I think, the finding that to me that was so striking was just the high prevalence of complications in these women overall. So, if you think that, okay, for every woman who's going to have a pregnancy, up to half of them is going to have a single complication. So for me, that's really encouraged me to ask women much more frequently, if it doesn't come up in a consultation, are you planning on having a family? To start that conversation a bit sooner, because there's a lot of questions over why these complications are happening. And I think disease activity is something that, maybe we need to look at in a bit more detail in this setting. So, if we can start those conversations around contraception and pregnancy planning earlier, hopefully we can optimize their general health, but also their disease activity earlier on. And then when they do become pregnant, have conversations at each step along the way about what's going to happen next. So that when a woman's in her first trimester, she knows, like, do we need to change medications? What are we going to do in the postpartum period? So everyone's on the same page. So for me, that was my biggest takeaway, just to be much more essentially, aware of these issues, because a lot of patients that we see in our clinic, we might get a phone call, oh, I can't make my clinic appointment today because I just had a baby, and we might not have known that they were pregnant. And the patient thinks that that's not a relevant thing to mention. But I think as rheumatologists, we need to be a little bit more involved with these patients during the course of their pregnancy, and also work with our obstetric colleagues to optimize outcomes here.
Yeah, no, that's great. Thank you so much for joining me today. And I really appreciate your insight. This is great work. And I wish you good luck in all your future research as well.
Thank you so much for having me.
For the complete article, please visit www.sciencedirect.com/journal/seminars in arthritis and rheumatism. If you're interested in more video content from seminars in arthritis and rheumatism, please hit the subscribe button. Thanks for watching.